Citizens Memorial Healthcare gives its physicians and nurses a unique tool that helps them to provide safe, efficient, and effective care to their patients. This tool is the Project Infocare Electronic Medical Record, or EMR. The EMR allows authorized clinicians quick and easy access to relevant patient information. All information is entered at the point of care, ensuring that authorized medical staff always have the most up-to-date information for use in patient care. The EMR is not only available to clinicians at the hospital or CMH clinics. Authorized care providers have access to it at our long-term care facilities, during home care visits, at the ambulatory surgical center, and at partnership facilities, such as the Carrie J. Babb Cancer Center. A patient can enter into the CMH system at any of these points and have a medical record that is maintained across the continuum of care. Since this paperless chart follows the patient throughout the system, care providers have access to a complete medical record whether they are in the emergency room, a clinic, or a long-term care facility. CMH clinicians are trained to share the screen with patients, allowing them to take a more active role in their own healthcare. Now let's take a closer look at what the Project Infocare EMR means to different patients throughout the CMH system. Erica has injured her knee playing basketball at a facility staffed by trainers from the CMH Sports Medicine Center. A trainer does an initial evaluation of her knee and recommends a CMH physician and an MRI. Erica is evaluated by her sports medicine provider, and the MRI is scheduled before she leaves his office. Once the MRI is complete, the images are sent to CMH's web-based Picture Archival System, or PACS. Her physician can now view and evaluate her MRI from his office. The PACS system allows providers to rotate and zoom images, as well as apply contrast to aid in diagnosis. Erica has torn her anterior cruciate ligament, or ACL, and is scheduled for surgery at the ambulatory surgical center. Since providers in the ASC have access to Erica's EMR, they can quickly review her medical history and allergy information. During preparation for surgery, Erica is hooked up to a vital sign monitor that feeds information directly into the EMR. After her surgery, Erica starts rehabilitation at the CMH Sports Medicine Center. Staff work closely with her physician to create a plan of care that will let her return to physical activity as quickly and safely as possible. Cindy has been diagnosed with cancer and has decided to start treatment at the Carrie J. Babb Cancer Center. Since CMH has partnered with Central Care Cancer Center of Kansas to bring this facility to Bolivar, authorized clinicians at the facility have access to Cindy's EMR, giving them a complete medical history. During her cancer treatment, Cindy visits her cardiologist. Since all of her care providers are documenting care in the EMR, her physician can ensure that the medications he is prescribing for Cindy do not interfere with her cancer treatment. Taylor was at the playground this weekend when she fell and injured her wrist. Her mother was worried that her wrist was broken, so they headed to the CMH emergency room. Since Taylor has been seen in the CMH system, registration was quick and easy. Her information was simply verified, and she was sent back to receive care. A nurse documented Taylor's medical information at the bedside. The ER physician could easily review the information entered by the nurse and recommended an X-ray. The X-ray reveals that Taylor has indeed broken her arm. Her ER physician uses our electronic order entry system to prescribe pain medication. This system provides a series of automatic checks looking for drug interactions or allergies. The system will alert the provider of conflicts or allergies. Nancy isn't feeling well and schedules an appointment to go see her doctor. During Nancy's visit, her physician is prompted to cover all of the bases of care based on her age, sex, and diagnosis. Even though Nancy is at the office because of a sore throat, the physician is notified that she is due for her mammogram. Since CMH uses central scheduling, the office staff is able to schedule her mammogram at the hospital before she leaves her appointment. Patients that require home care can also benefit from the EMR. Our home care nurses use software that supports real-time point-of-care documentation in the home and integrates with the CMH EMR. If a home care patient had been admitted to the hospital or visited any other CMH facility for treatment, care providers would have access to the information from their home care visits. CMH also offers the Well-at-Home device to home care patients. Patients can use the Well-at-Home device to monitor vital signs and other information in their home as prescribed by their physician. The Well-at-Home device is connected to a phone line and securely sends the information to the EMR. This allows physicians to closely monitor a home care patient and make decisions about their care based on the information received from the Well-at-Home device. Bob recently had a hip replacement and is staying at a long-term care facility for his recovery. All of his rehabilitation sessions at that facility are documented in the EMR. This allows his doctor to easily follow his progress and make adjustments to his care plan as needed. When his physician visits the facility, he can spend more time with Bob, since he does not need to rely on staff to keep him up to date on Bob's condition. Our long-term care facilities use bedside medication verification, or BMV, to ensure that the right patient is getting the right medicine at the right time. CMH works closely with local retail pharmacies who package the medications with barcodes for our facilities. Staff is notified when a patient's medication supply is getting low, and with certain medications, they can automatically order a refill from the pharmacy. Bedside medication verification is also used in the hospital. With Project Infocare, CMH is integrating technology and medical care with the goal of providing safe, efficient, effective, and patient-friendly care. By providing shared access to patient records across the Citizens Memorial Network, we are helping to ensure patient safety and increase the quality of care at our facilities. Patients can enter anywhere in the CMH system at any point of care and have a personal identity that is maintained across that continuum. With the Project Infocare EMR, our physicians have access to an easy-to-use, reliable, and complete medical record. Citizens Memorial staff have a direct link to the patient's history, treatments, medications, billing, and insurance information. CMH is an integrated rural healthcare system, serving 80,000 people in southwest Missouri. We provide hospital care, an emergency department, ambulance services, outpatient services, physician clinics, long-term care, residential care, and home care. CMH launched Project Infocare as a part of the long-term plan to ensure that CMH meets the demands for healthcare in our rural communities and offers new integrated services to current patients and the community at large.